Hello, welcome to BEMER. My name is Chitwan Malik and I live in the San Francisco Bay Area, and I've been a holistic health educator for the last 7 years. I got introduced to the BEMER 7 years ago, and this is what the BEMER looks like. It's a mat that you lie on. You can either put it in your bed or on the floor, or you can put it on a chair. And all you need to do is press a button and use it 8 minutes twice a day. It's really easy to use. After you've used it for 6 weeks, you can then start using the all-night sleep program, but we'll come to that later. So BEMER has 5 patents. BEMER comes from Liechtenstein. It is German engineering and Swiss craftsmanship, so which really makes it one of the best combinations in the world. BEMER's been around for 15 years. We have over 50 medical publications, and these medical publications are all specifically on the BEMER, not just quoting other research. We have 5 patents and over 1 million users worldwide. BEMER can be found in 48 countries now. It's available around the world. BEMER is a Class 2 medical device, and in the US, it's a FDA-registered Class 1 medical device. This means that doctors, hospitals can all use the BEMER now and prescribe it to their patients. A lot of doctors in the US, in Europe, and around the world are now prescribing the BEMER to their patients. So why do we need the BEMER? Well, ideally, we should all be walking 18 to 27 miles a day, which is equivalent to 30 to 45 kilometers a day. But guess what the average now is? It's under half a mile. So because of that, there are more and more rise in chronic health issues. Younger and younger children now have all kinds of health issues. You might have heard of the rise in health issues like juvenile diabetes, or children with insomnia, or children on antidepressants, or the rise in autism, for instance. So one of the reasons for it is that we are just not walking, moving enough. Ideally, we should all be living like hunters and gatherers, walking barefoot 21 miles a day, which is equivalent to walking from in 1 year, we should be walking from New York to San Francisco back to New York every year. So what else is happening in our world today? There are 45,000 different diseases. The root cause of most of these diseases, I would say around 80% of these 45,000 diseases, is disturbed microcirculation. There's not enough blood flow getting to where it needs to go, and the wastes are not being removed. Also, what else is happening? Do you know what the top 3 causes of death in the United States are? Number 1 is heart disease, number 2 is cancer, and number 3 is wrongly prescribed medications or the side effects of medication or pharmaceutical drugs. So it's really important for each of us to be educated and to really take care, be responsible for our own health. When somebody goes to a doctor, it's usually when they can't bear the symptom anymore. And the symptom is just the tip of the iceberg. The root cause of diseases goes down to not enough blood flow and oxygen deficiency right at the cellular level. And this is where the BEMER is working at. And this is why BEMER is not a quick fix. It's not that you use the BEMER one time and, there's a miracle happens. BEMER is highly scientific and it's working right at the cellular level. BEMER gained popularity when a few years ago, the German government asked the Institute of Microcirculation in Berlin, specifically Dr. Klopp, to test out all the pharmaceutical drugs, therapies that were available to increase the quality of life of anybody over the age of 50. There was one condition though, that it should have absolutely no side effect. So here is Dr. Klopp, and Dr. Klopp, when he did his research, he found that out of all the natural remedies, ginkgo biloba was the most effective therapy to improve blood flow. But even that, at the therapeutic doses that it was needed, long term caused leakage of the blood vessel walls. And also, at most, ginkgo biloba increased microcirculation by 5 to 7%. He also looked at beta blockers, which increased blood flow from 7 to 10%, but they had all kinds of side effects. So Dr. Klopp then wrote a book on microcirculation and spoke about why the BEMER was the most effective thing out there right now that increases microcirculation with absolutely no side effects. So here are some of the blood videos that Dr. Klopp has for us. Dr. Klopp is one of the only people in the world that has access to this very special technology that takes these live videos. This is, you're looking at the microcirculation of a healthy 25-year-old semi-pro athlete, and you can see how the blood cells are clumped together. Now what you're looking at is 8 minutes of BEMER use, and notice how all the microvessels have dilated and the blood is moving freely. Now when somebody has pain in any part of their body, it basically means there's not enough blood getting to that area. Here you can see the comparison. In the green you can see the before, you can see there's barely any movement of blood, and within an 8-minute session, this is what the BEMER is doing for somebody who is already very active, a semi-professional athlete. The other thing that the BEMER is doing is increasing energy. So would you like more energy? Would you like to wake up in the morning just charged, ready for the day, ready to live your dreams and do what you're supposed to? Well, most of us, generally don't have that kind of feeling. A lot of people need to go and get their cup of coffee before they can start doing anything. So the other thing that the BEMER is doing is it's increasing ATP. What is ATP? This is cellular energy, and it stands for adenosine triphosphate. So here we have an image of a cell. Ideally, when we would be walking 21 miles a day barefoot, inside our cell, there's a little organelle called the mitochondria. The mitochondria would then get stimulated when we walk by the Earth's static electromagnetic field, but when we walk, it gets stimulated to produce ATP. This ATP is used to keep the cell membrane wall strong. 50% of the ATP that's produced is used to keep the cell membrane wall strong so that all the oxygen can get in, the nutrients can get in, and the waste products can go out. Having cell membrane potential that is between minus 70 millivolts to minus 90 millivolts is really important. Scientists have found that when this drops down to say minus 40 millivolts or minus 45 millivolts, you see rheumatoid arthritis. When it drops down to minus 20 millivolts, that's when you're seeing a cancer cell. So basically, when there's not enough ATP being produced, the cell shrivels up like it does like a raisin or a prune. And the minute you get on the BEMER, you press that button, right away the mitochondria starts producing more ATP, and as a result, the cellular metabolism takes place right at that cellular level. So here are some before and after pictures. This is before using a BEMER session. You can see how the blood cells are all clumped together. So for instance, if you take a child who has autism, who's on the autism spectrum disorder, and they are in a hyperbaric chamber, if the blood cells are clumped together, they're not able to take in oxygen. The cells are not able to take in oxygen. The minute you put the person on the BEMER, here you see after 8 minutes of a BEMER sessions, the cells separate, the cell membrane wall becomes strong, and now oxygen molecules can actually go inside the cell. Every cell has 4 docking stations for oxygen molecules, and within an 8-minute session, just by lying on the BEMER and just by breathing, you can have more oxygen that's going inside your cells. This is really important for all health issues because we understand, for instance, cancer cannot survive in an oxygenated environment. Over here, what we are looking at is the microvascular system. So one of the most biggest and important systems in our body is the whole circulatory system. So this was a surprise to me when I learned that just 11% of the blood is moving through the arteries, 14% is moving through the veins, and 74% of the blood moves through the microvessels. Now, what happens as we age? These microvessels stiffen up and they lose their ability to pump blood. If you were to remove the microvessels from one person's body, just from one person's body, you could wrap it around the earth. You could wrap the microvessels around the earth 2.5 times round if you were to place these microvessels end to end. So this is the vast network which exists within our body. And here we are looking at the heart. Every day there's 2,000 gallons of blood that's moved through the body. Do you think that the heart is doing that by itself? No, it can't. There is something else that's happening in the body, and this is called vasomotion. We can see over here the blood vessels are dilating and contracting. And by this way, the blood vessels are moving the blood. They're sending it down to your toes, down to your fingertips, down to your brain. And this is called vasomotion. So this is what these muscle walls, as we age, they stiffen up. They lose their ability to pump blood. Ideally, in a young, healthy person, there should be 30 to 50 beats in 10 minutes. Or in 1 minute, there should be 3 to 5 beats. But anybody who's elderly, who's ill, especially people who are diabetic, what happens is instead of 30 to 50 times, there's only 1 beat in 10 minutes. And so as a result, there's poor blood perfusion to the extremities, and somebody may develop, for instance, somebody with diabetes may develop diabetic leg ulcers, or an elderly person who has a fracture because the blood's not getting to that area, they don't heal as quick. So this is really important, and this is where the action of the BEMER is taking place. BEMER is working right on the nerve impulses of these blood vessel walls, and it's also releasing nitric oxide release, a natural phenomena that happens in the body, but BEMER is assisting the body to do that. So as a result of lying on the BEMER for 8 minutes, now these were all clinically proven, there was a 27% increase in vasomotion. Now, even physical therapy or exercise at most can only increase vasomotion by 7%. But BEMER increases it by 27% after an 8-minute session. Then 29% increased microcirculatory blood flow. Like I said before, even the strongest medication like beta blockers can only improve blood flow by 7 to 10% with all kinds of side effects, but here there are no side effects. Then venous blood return. Now we don't have any kind of therapy or medication that can help to improve venous blood return, but BEMER improves it by 31%. So people, for instance, who have varicose veins, spider veins, poor circulation or swelling in their legs can see a great improvement when they start using the BEMER. And the last thing, 29% increased oxygen utilization. So this is really important for everybody because as we know that disease cannot thrive in an oxygenated environment. And also, for instance, a child with autism, when you have more oxygen in the brain, when the mitochondria is functioning properly, the memory is enhanced, cognitive function is enhanced. So these are some of the effects that happen. You're probably wondering what those numbers are in the brackets. Those are the effects with the older generation BEMER. So there was a BEMER, the first BEMER generation that was introduced 15 years ago, that still had a significant improvement. But now the new generation, the BEMER Classic and Pro, are almost doubly more effective. So getting a little bit into the science here of how the BEMER signal that comes through the mat and goes through and through every cell in your body, including your bone cells, what this signal is doing. In the heavy calibered arterioles, it stimulates the nerve impulses and gets that vasomotion, that pumping action started. And in the light calibered arterioles, it's increasing nitric oxide release. As a result, the blood gets to the capillaries, and that's where all the action is happening, and all the waste is removed through the venules. Now, like I said, there is no other therapy that can work both on the arterial and on the venule level the way the BEMER is working. Even beta blockers, for instance, only work on the heavy calibered arterioles by artificially dilating those blood vessels, and that is why all the side effects happen. But the BEMER is working by bringing the action back to normal. It doesn't increase, it doesn't bring it down, it regulates. So BEMER regulates the body's natural function, and as a result, the body heals itself. So it's not that the BEMER that's healing anything, the body heals itself when everything in the body is working optimally. What are some of the possible consequences of impaired microcirculation? Well, here are just some of those 45,000 different diseases. I couldn't list all of them here. So here we have diabetes, poor wound healing, osteoporosis, heart attack, migraines, arthritis, stroke, dementia, kidney impairment, and we could go on and on, multiple sclerosis, neuropathy in hands and feet, pain, all kinds of cognitive function. All of that is enhanced when the circulation is enhanced in the body. Now we're going to see one of my favorite blood videos, which is going to show you the changes in the body within 90 seconds. So this video is not animated. This is in real time. You're going to look at the blood flow in the intestinal area and how within 90 seconds the effect of the BEMER totally unblocks this vascular blockages. So you can see over here, it's like a little thrombosis in one of the little tiny venules, and the blood is, there's no poor blood perfusion, there's not enough nutrients that are being delivered, the wastes are not being picked up, and over time more and more tiny blood vessels get clogged up. But now keep watching within 90 seconds and you're going to see the action of the BEMER. Observe over here, you can start to see an increase in movement. And now look at that. Within 90 seconds, the whole blockage is just clearing up, and it's like opening up your kitchen drain, just pouring some Drano and clearing that up. So the same thing, within 90 seconds of lying on the BEMER, this is the action that takes place. And this video is not animated, this is real. A lot of people ask me that and wonder about that. This is all taken with the intravital microscope that Dr. Klopp has at the Institute of Microcirculation. So here are some of the results. When those blockages open up, here you're looking at a diabetic ulcer. This was a 3-year-old condition this person was facing, and his only choice was amputation now for his leg. And after 4 weeks of using the BEMER, look at the changes, and then after 8 weeks. This is just phenomenal. And we see this over and over again. We have so many documented pictures of people who've avoided amputation as a result of using the BEMER. Here you can see a diabetic ulcer on the sole of the foot and how after BEMER use it has cleared up. Here's an 88-year-old lady who is bedridden. She has ulcers and bed sores, and after 2 years of conventional therapy, you can see that there's really nothing that medicine can do for her. And as she starts using the BEMER, you can notice over here after 6 months, 8 months, 9 months, and look how well she's healing. Now, this is so important. If you know somebody who's bedridden or who's in a nursing home, BEMER would be so important for them to have a BEMER in their bed, because you can't expect them to exercise, and definitely not 21 miles a day. Here you can see images of a young boy who had an accident. I think he was on a bicycle or a skateboard, and you can see how quickly wound healing happens with the BEMER. The first, second, third, and by the fourth day, you can see his smile is bigger, and so is his healing. And within 7 days, look at that healing. Here is now a picture of what happens with the BEMER in your immune system. Now, again, this is really important because, for instance, you're going to see before a BEMER session, the white blood cells are not adhering to the vessel walls, which is what they're supposed to do. Here you just saw white blood cell go by, and you're going to see another one zipping by. This is before a BEMER session. And now within an 8-minute BEMER session, look at that. The white blood cells are adhering to the vessel wall, and now this strengthens your whole immune system. One of the new research that was recently published for children with autism said that one of the things that was found was that their cells were not adhering. But here you can see with an 8-minute BEMER session how the white blood cells are adhering, and as a result, everybody's immune system gets stronger as they start using the BEMER, because now the cells have the energy to do what they're supposed to do and what they were designed to do. Earlier, the cells were not being able to do what they were supposed to do. And you can see the action again before over here. There's barely any adhesion that takes place, and within 8 minutes, you can see the difference. Now, the next thing that the BEMER is working on, well, the BEMER is working on all over the body, wherever there's blood flow. But at the Berlin Charité University Hospital, they did a specific study, and they observed that by the 20th day of using the BEMER, there was a clear increase in blood flow in the liver. As a result, there was a reduction of fatty liver conditions and a clear increase in glutathione. Now, glutathione is a natural antioxidant. It's a really important antioxidant that shows liver health. And after the person was using the BEMER for 20 days, there was a clear increase in glutathione, and which means improved liver health and improved well-being. You can now watch a video that was also taken at the Berlin Charité University Hospital, and this is for somebody who had alcohol-related fatty liver. This was 2 weeks before and after the treatment. Now, ideally, the liver is like a sponge. The blood flows like this is how the blood should be flowing. This is a hepatocyte that you're looking at, and the blood should be flowing freely, cleaning up, and just like it would in a washing machine. Now you're going to see the blood flow of somebody with alcohol-related fatty liver. Notice how the liver cells are so inflamed, and there's barely any place for the blood to flow through. It's completely clogged up, and the blood is not moving through. And so this poor person must be feeling really tired, fatigued, perhaps headaches, or skin conditions. Notice what happens within 20 days of using the BEMER. Look at that. It's like a mighty river now, cleaning up everything, all the residues of toxins that are not supposed to be there. As a result, a lot of people who do have food allergies find that their allergies start to clear up. People's skin condition gets better when their liver health improves. Also, their cholesterol levels seem to improve. People who get frequent migraines have better results when their liver function is improved. We can see some images of people with various skin conditions that have been improved after using the BEMER. This is somebody with psoriasis. We have significant results with people who have acne. You can see over here, this is 14 days of using the BEMER. BEMER is really helpful for teenagers who are dealing with teenage acne, and it can really help them too. Here's somebody with cystic acne. This is acne infection, and you can see how quickly it has cleared up. This is somebody with eczema, and notice this is within 2 days of using the BEMER. So that is pretty remarkable. Instead of using, cortisone creams or using things that are not really addressing the underlying cause, by lying on the BEMER, helping all the organs to detox, regenerate, giving the cells the energy that they need to function, you can see the changes very quickly. This is somebody with a basal cell carcinoma. This is on the bridge of their nose, in case you're wondering where this is. And you can see after 8 therapies with the BEMER mat, the applicator and the light applicator, you can see how the carcinoma has reduced. And then it was very easy to surgically remove it and then also help the person to heal without a scar. This is somebody with herpes zoster virus, and this is apparently excruciatingly painful and can cause blindness in the eye. And with using the BEMER and using the BEMER red light, within 3 days, the person has cleared up the inflammation. One of the wonderful effects that people who've been using the BEMER long term have noticed that their hair has started growing thicker and darker. Here you can see one lady, this was late September 2007, and look at her hair, and then look after a year later, or less than a year later, in fact, how her hair not only has it grown thicker, but also darker. A lot of people have been observing this, that their hair is changing color. So that's a wonderful thing that can possibly happen. We also have a study with osteoblasts that was done, and that study showed that BEMER helped the proliferation of bone cells 4 to 5 times faster. This is really helpful for people who had a fracture. So here we are looking at somebody who had a non-union fracture, and they had to have surgery and put a rod inside, but their bone just wasn't healing. After they started using the BEMER, you can see what a wonderful callus is being formed around the non-union fracture, and the BEMER helps the cells, the osteoblasts, to regenerate bone cells. This is really important, especially for the people who are elderly, because very often once an elderly person has a bone fracture, sometimes they're too weak to go through surgery, and after that it's all downhill for them. But if you can get them to using a BEMER right away, this can really make a big difference for them. We have also a lot of studies on MS, on multiple sclerosis. We have seen a lot of results, and you can find these studies. In fact, you can find a lot of studies on the BEMER on PubMed. If you go to pubmed.gov, you can put in the word BEMER, and you can find studies on diabetic polyneuropathy, on lymphoma, on multiple sclerosis. There's also a comparative study that compares BEMER with all other devices and shows that BEMER is truly the most effective in this whole category. Actually, there's nothing else that even comes close to what the BEMER can do. BEMER is also helping eye health. So we have a doctor who's been doing a lot of research on macular degeneration, helping people avoid cataract surgeries, improving peripheral vision, improving frontal vision. And here you can see an image of somebody with diabetic retinopathy. This is one of the #1 causes of blindness around the world. You can see over here there's an inflammation in the eyeball. And then notice after 2 months and after 9 months how using the B-pad over the eyes has gradually cleared up that inflammation, and the person's vision is restored. So a lot of good results are being observed every day with BEMER and eye health. One of the things that people often wonder, is BEMER safe for premature babies, for children? Yes, here you can see that BEMER is being used in incubators also with premature babies. There was a study that was done many years ago where it was found that babies that were born highly premature, um, uh, only 1 out of 10 were surviving. And then after they started using the BEMER, the survival rate dramatically went up. So BEMER, and why is that? Because BEMER is helping to release nitric oxide. A lot of times when premature babies are born, they are actually injected with nitric oxide so that there's a dilation of blood vessel walls, so that there's more blood perfusion, more oxygen. But in this case, BEMER is assisting, and therefore we're getting such good results. So yes, BEMER is safe to use with children also. We have two models, the BEMER Pro set and the BEMER Classic set. Over here, you can see the BEMER Pro set. The BEMER Pro set is really like a 2-in-1 because you can use two applicators at the same time, or two people can use the Pro with different settings, on completely different settings. Plus, the Pro set comes with all the accessories, with the B pad, the B spot, the B light, and it's all inclusive. It has a touch screen, and with the Pro set, you can also create and program your own programs, so that it gives greater flexibility. It is for 5,990. We also have a rental option that's available. BEMER really wants customers to be happy and has introduced this rental option where people can rent a BEMER for $990 for 8 weeks, and then the rental is applied to the purchase. There is also the classic model. This comes with the mat and with the spot applicator, and you can buy all the other accessories separately, and this is for $4,290. BEMER comes with a full 3-year guarantee, and it has a special USB port so that you can have lifetime system updates. So if there are any improvements in the BEMER, you would get free system updates to update your software on your BEMER. Now here is one of our last blood videos that is really impressive. This has been taken with somebody with chronic stress. Now we can all relate with somebody who has chronic stress, or maybe we've had periods in our life that we've dealt with stress. And as we all know, that doctors around the world say that stress is really the biggest factor underlying all health conditions. So even if somebody has no other health conditions, but if they're just dealing with life stress, you can see this is before a BEMER session. Look at the blood perfusion in the colon. You can see how the blood cells are clumped together and there's barely any blood moving over here. And on this side, you barely see any white blood cells. There are no white blood cells that are adhering to the vessel wall. Now, as soon as one pressed, this is using just level 3 on the full mat, as soon as one pressed the button, look at the changes. Look at the blood perfusion that's happening within a few minutes of switching on the BEMER. This is quite remarkable. And this is not just happening in the colon, this is happening all over the body. This is happening in the brain, in the liver, in the kidneys, in your feet, in your toes. Now this is during a BEMER session, in the middle of a BEMER session. Look at the blood perfusion, how it has increased. And now you can see also that the white blood cells have started adhering to the vessel wall. So definitely BEMER helps increase the adhesion of the white blood cells, and as a result, it strengthens the immune system. And look at this. This is immediately after an 8-minute BEMER session, and look at the blood perfusion now. And so imagine, this is how the blood ideally should be moving in somebody's body. And you can see the comparison now. This is before a BEMER session. And now which one would you like to have? Or this after a BEMER session? This is within 8 minutes of lying on the BEMER. And like I said, this could be your brain, or this could be the colon, and as we all know, there's a big connection with the gut and the brain. So it's important to have blood perfusion throughout your body. BEMER also works on horses. We also have a veterinary model that works on horses, and this shows that it is not a placebo effect, because I always say the horse never saw this BEMER presentation, and we can see it still works on our animal friends too. Over here, there are thermographic readings. You can see the small little BEMER applicator over there. And within 2 minutes of a BEMER session and within 3 minutes of a BEMER session, notice the perfusion of blood flow. So a lot of people who love their horses have the BEMER veterinary model. BEMER can also be used for your cats, your dogs. We have lots of people with pretty remarkable experiences. So this is a real dog lying on their human owner who's lying on top of a BEMER. And you can see the dog is quite blissed out. So animals just love the BEMER. BEMER is also being used by Olympic athletes around the world, by both professional and semi-professional athletes around the world. It's endorsed by the Swiss Olympic Committee. BEMER is being used by some of the famous people, the Milan Football Club, for instance, many of the marathon runners, professional bikers who take part in the mountain bike races are also using the BEMER, because BEMER helps to reduce lactic acid, and that is really important for athletes. First of all, it's giving them the competitive edge. It's increasing their ATP. It's increasing energy. And then it's because of the increased blood perfusion, there is an increase of lactic acid removal, which means that very quickly they can recover for an event and get ready for the next event. Also, injuries heal much faster when they use the BEMER, and that is really important. Professional athletes also have to pay attention to their immune system, because they have such a high lactic acid production, it is easy for them to fall sick. But when they use the BEMER, their immune system is also getting stronger. So here you can see it's all in your microcirculation, whether it's physical performance for professional athletes, whether it's increased mental functioning for somebody with Alzheimer's or dementia or a child with autism, strengthening the immune system, anti-aging, detoxification, for pain, for insomnia, hormone regulation, increase in endorphins. And of course, whatever natural supplements that you're having, whatever nutritional supplements you're taking, BEMER is going to help them all work better, because it's going to help them to actually get absorbed into the cells, so you get much more from your nutritional supplements as a result of using the BEMER. So in closing, you can't get younger, but yes, you can definitely, and you do feel younger when you start using the BEMER, and you